Hello viewers, I'm Dr. Phani Krishna. I'm a surgical gastroenterologist and a GI cancer specialist. Today we'll be discussing about pancreatic cancers. What is pancreatic cancer? Basically, the pancreas is a fatty filled structure which is located in the posterior part of your body. It is sort of lying against the spine. The main functions of the pancreas, the most important functions, though it has several functions, the most important functions are, one is insulin and glucagon production, by which it regulates your sugar levels, and also the pancreas produces a lot of enzymes that are involved in digestion. Among the enzymes the pancreas produces, it's very important for fatty food digestion. So the pancreatic tumors, the tumors or cancers which occur in the pancreas are several types. You have basically the three broad varieties. You have pancreatic adenocarcinomas, you have cystic neoplasms of pancreas, and neuroendocrine tumors. So most of the time when we're talking about pancreatic cancer, we are talking about pancreatic adenocarcinomas. So these are very aggressive tumors, pancreatic adenocarcinomas, and they generally tend to have not a very good prognosis. They are poor prognosis tumors. So the pancreatic adenocarcinomas, they arise from the ductal lining of the pancreas. The pancreas, obviously the pancreas secretions have to reach the intestine. They do so through a small duct, and the lining cells of this duct actually become cancerous, and they lead to adenocarcinomas. So pancreatic adenocarcinomas are similar to what we see in the intestinal cancer and the gastric cancers. So they are from the glandular cells. The other types of pancreatic tumors, one is the cystic neoplasms of the pancreas. These are less common, but again in a referral centers like ours, we see them fairly commonly. Cystic neoplasms are of several types, such as mucinous cystadenomas, solid papillary neoplasm, serous cystadenomas, and IPMN. These kind of cystic neoplasms, they are relatively less aggressive than pancreatic adenocarcinomas. So most of the time they grow to a fairly large size slowly over years, and they don't spread much to other structures like lungs and liver. Less common, the spread is much less common than pancreatic adenocarcinomas. So once you do surgery, the cure rates and success rates for this treatment of the cystic neoplasms is very high. The third variety is neuroendocrine tumors. The kind of tumors which say Steve Jobs had. So these neuroendocrine tumors, again, unlike adenocarcinomas, they are very slow growing tumors. Not all, but especially the low grade and the intermediate grade neuroendocrine tumors. The high grade neuroendocrine tumors behave like adenocarcinomas, but the low grade and the intermediate grade neuroendocrine tumors, they are very slow growing tumors. For example, a pancreatic adenocarcinoma, which starts in the pancreas, can spread to the lungs and liver. The patient's survival is usually less than a year. But while a neuroendocrine tumor can spread to the liver and the lungs, patient can go on for many years, can survive for up to 20 years also they can survive, despite being a stage 4 tumor. What causes pancreatic cancer? Habits like chronic alcoholism and chronic smoking increase the risk of pancreatic cancer. Likewise, obesity puts you at a higher risk of pancreatic cancer. High intake of fatty food puts you at a risk of pancreatic cancer. Pancreatic cancers are much more in males than females. Age more than 65, you are at higher risk of pancreatic cancer. Patients with chronic pancreatitis, so patients who have chronic inflammation and scarring of the pancreas, which could be secondary to alcoholism. In some cases in India, we have tropical chronic pancreatitis, and we have hereditary chronic pancreatitis. So any of these conditions in which the pancreas is chronic, if you're a chronic pancreatitis patient, you need to serially follow up every year to rule out the risk of pancreatic cancer. Then there are some other familial syndromes like Lynch syndrome, BRCA, familial atypical mole syndrome. These kind of syndromes put you at a risk of pancreatic cancer, especially if there are more than one first degree relatives, close relatives of you who have had pancreatic cancer, and a lot of cancers in your family are occurring in age less than 40. You can have other like colon, breast, thyroid cancer, and pancreatic cancer. If you have more than 2 close relatives having these cancers, especially at less than 40 years of age, you need to get yourself checked for these kind of familial syndromes. In addition to the above mentioned risk factors, you also have some familial syndromes which can increase your risk of pancreatic cancer. So you have syndromes like Lynch syndrome, BRCA2 mutation, familial atypical mole syndrome. So these kind of patients are at risk of pancreatic cancer. So who should get themselves checked for these hereditary syndromes is in your family. If there's a clustering of tumors, like more than 2 of your close relatives, and a lot of your relatives are getting cancer at less than 40 years of age, it may not always be pancreatic cancer. They can be other cancers like breast cancer, ovarian cancer, colon cancer, thyroid cancer. So when there's a clustering of these kind of cancers in more than 2 of your relatives, especially at a young age, then you need to get yourself checked for these familial syndrome risk factors. What are the symptoms of pancreatic cancer? The main symptom of pancreatic cancer is usually abdominal pain and abdominal discomfort. It can start off as a vague abdominal discomfort, and progressively as the pain worsens, it can become a very severe abdominal pain which is not even relieved by painkillers. And the pain typically of the pancreas, one typical feature is that the pancreatic pain spreads to the back. So when a patient has an abdominal pain which is radiating to the back, we should always suspect that it could be a pancreatic pain. As the tumor progresses, pancreatic cancers have a lot of cachexia. Cachexia means basically a severe loss of appetite and weakness of the patient with progressive loss of muscle mass leading to severe weight loss. That is a typical feature of pancreatic cancer. Any elderly patient, if he has unexplained severe weight loss, we should always evaluate for any pancreatic problems. As the tumor, depending on the location of the pancreas, you can have other symptoms as well. For example, pancreatic tumors in the head of the pancreas, they obstruct the bile duct and cause jaundice and itching very early. While the tumors in the head and the mid-body of the pancreas, then actually obstruct the intestine and cause intestinal obstruction, which leading to persistent severe vomitings. So these are the main 4 symptoms would be severe pain, especially relating to the back, weight loss of appetite, and jaundice, and sometimes vomiting. Of course, as the pancreatic tumor becomes much more advanced, you can have other symptoms like fluid inside the tummy and fluid around the lungs and all that, but that's usually a feature of very advanced disease. The neuroendocrine tumors can actually produce hormones, and they can have various symptoms like flushing, diarrhea, syncopal attacks, very high BP. So they have some atypical presentations. The cystic neoplasms of the pancreas, most of the time they don't cause any symptoms. They're usually picked up during some general checkups, or sometimes they can reach very large sizes and have a feeling of a lump in the abdomen. A patient can actually feel a fullness or a swelling inside the abdomen. Especially in elderly males, if you have chronic fatigue, lot of tiredness, poor appetite, recent weight loss, vague abdominal symptoms, notice a lot of itching, or urine has become very dark colored, these are the sort of symptoms which should make you go to a gastroenterologist to rule out any pancreatic pathology. How do you diagnose pancreatic cancer? So the diagnosis of pancreatic cancer is a slightly challenging area. The most common test when you have some abdominal discomfort in the upper abdomen, patients go to a doctor for an upper GI endoscopy and an ultrasound. Unfortunately, neither of these 2 tests can pick up pancreatic cancer. So, an ultrasound, because I said pancreas is located really in the back of the body, it's located behind the stomach and the intestine. So because of the intestinal gases, you can't see the pancreas properly. And on the endoscopy, obviously it is only the intestine, and pancreas lies outside the intestine, so you cannot see the pancreas properly. So it is a big problem for us that many patients have a lot of abdominal symptoms, vague abdominal pain and abdominal discomfort. They undergo multiple times ultrasound and endoscopy, and the pancreatic tumors are missed, and then by the time they come to us, they present at a fairly advanced stage. So once you have a suspicion of pancreatic cancer, sometimes an ultrasound can pick it up. I mean, when you have pancreatic cancer in the head, which is causing jaundice, your ultrasound can actually pick up the liver has become swollen, and the ducts inside the liver have become swollen. But especially when you have a suspicion of pancreatic cancer, the best investigation would be a CT scan or an MRI. The CT scan or an MRI not just tells us gives us a diagnosis of pancreatic cancer, it also tells you what stage it is at. Is it located within the pancreas? Has it involved any blood vessels? Has it spread elsewhere to the lungs or the liver? Once you have the CT and the MRI, sometimes we also do a PET CT scan, whole body PET CT scan, to actually stage any distant spread of the pancreatic cancer. In some cases, with the CT and MRI is enough to diagnose pancreatic cancer, but in some settings there is always a diagnostic dilemma, especially when you have chronic pancreatic cancer in the setting of chronic pancreatitis, or when you have a neuroendocrine tumor. You need to get a confirmation of pancreatic cancer by doing a biopsy test. So even for the biopsy, unfortunately, because the pancreas is located in the back part of the body, it's very inaccessible location. It's very difficult to get a biopsy. So most of the time we do something called an endoscopic ultrasound. So we put an endoscope. At the tip of the endoscope there's an ultrasound machine that goes into the body, and we put the endoscope, the ultrasound machine, just next to the pancreas, and then we take a biopsy, or sometimes if there's cystic neoplasms of the pancreas, we can actually aspirate the fluid and send it for testing. So the EUS endoscopic ultrasound plays an important role in the pancreatic tumor diagnosis. There are some blood tests used to diagnose pancreatic cancer. The tumor markers like CA19-9 and CEA can be used, but the problem is these are not elevated in all pancreatic cancers. That's number one. And sometimes other conditions can also lead to, like pancreatitis, inflammation of the pancreas can also lead to elevation of these tumors. So these markers are good for follow-up of these pancreatic cancers, to see if once you do the treatment, has the tumor come back for follow-up. But for diagnosis, the tumor markers are not very useful in pancreatic cancer. How do you prevent pancreatic cancer? The prevention of pancreatic cancer is mainly by having a healthy lifestyle. Alcohol and smoking lead to pancreatic cancer, so alcohol and smoking should be avoided. Obesity, a sedentary lifestyle, and excess fatty food intake can lead to pancreatic cancer. So having a healthy, active lifestyle, eating a lot of fresh foods and cutting down on the junk foods and the carbs and the fatty foods is very important in preventing pancreatic cancer. In addition, patients who have underlying chronic pancreatitis, be it idiopathic, be it secondary to alcohol, hereditary or tropical chronic pancreatitis, if you are a known case of pancreatic cancer, every year you should get an imaging like an ultrasound or a CT scan and a tumor marker like a CA19-9 done to rule out pancreatic cancer. So these patients, by regular screening, can help us detect the cancer at an early stage. Then patients in which you have, like we discussed before, if you have more than 2 family members, 2 of your close relatives have had pancreatic cancer, or the group of other cancers like which I mentioned, ovarian, breast, thyroid and colon cancer. If 2 or more of your close relatives have these cancers, and especially if they have had it at a younger age, less than 40 years of age, then you need to get yourself tested for pancreatic cancer, for genetic mutations like BRCA2 and Lynch syndrome, which can predispose you to pancreatic cancer.